My talk will be on what to know before I get vaccinated and what to expect afterwards. So it is important to know that immunization saves lives and keep people healthy. It saves millions. Vaccines are available to protect against many infections. As well, it is important to know that more are in development. So how do vaccines work? Initially, what scientists want to do is try to mimic an infection, try to make the body think that there is an infection going on, produce antibodies, and to keep those antibodies in the human body in preparation for the next infection, so that it will be already there. So the body here is exposed to either a weakened or dead pathogen, germ, or a synthesized protein of that pathogen, such as in the COVID-19 vaccines. So what happens after that? The body's immune system will make antibodies to attack that pathogen that has been injected in the vaccine. Then it produces this type of memory antibody, so that if the body is exposed to this pathogen again, the body will be prepared with those antibodies. So vaccine dosing through the lifespan varies. There are some vaccines that provide lifelong immunity just from a single dose, like the BCG or for TB. Others provide greater protection after multiple doses. One of them is what we have currently, the COVID-19 vaccine. And new vaccines are needed frequently for pathogens that mutate often, such as the influenza virus, and as well as you can see now, the rapidly mutating and changing COVID-19 virus. Now, why do we have to get vaccinated? Why not, for example, get infected and we'll get natural immunity? Well, infection is not really similar to vaccination. You may become very unwell with COVID-19 infection. You may develop long-term complications, chest complications, and others. And don't forget, you will be more likely to spread the virus to others, more risky individuals, such as the elderly or those with some chronic diseases. While in vaccination, this significantly reduces the chance of developing COVID-19, or even if you develop the infection, you would be less likely to be very unwell and very likely to prevent death. It induces an immune system in a safe and controlled way, and you reduce the chance of spreading the virus to others and also to developing complications from COVID-19. So the vaccine components, we were worried about the vaccines in general, and especially more worries came with COVID-19 vaccine especially. So let's think about the vaccine components. Generally, these are safe and effective. So vaccines are made of the active ingredient, as we've mentioned. Those are the pathogens, whether they are weakened, what we call antigens, along with some adjuvants, so something to help make a stronger immunity. There are preservatives and stabilizers in order to keep vaccines safe and long-lasting, and some other ingredients such as antibiotics and others that are used in the production of vaccines. Now, how are vaccines safe? How do governments and scientists prove that these vaccines are safe? Well, it undergoes a very vigorous process. At the beginning in phase 1, they try it after trying it in animals or cell cultures. They try it on 20 to 100 healthy volunteers, maybe even more. And their main questions are, is this vaccine safe? Does this vaccine seem to work? Are there any serious side effects? And how is the dose related to side effects, if any? Then it comes to phase 2, where several hundred volunteers are involved. And the questions to be answered are, what are the most common short-term side effects? How are the volunteers' immune system responding to this vaccine? Is it adequate or not? Then comes phase 3, where hundreds of thousands of volunteers participate. And the question here is, how do they compare those vaccinated with those who are not vaccinated? Whether they get more severe infection or less infection, etc. Is the vaccine safe, and is the vaccine effective? So Johnny has mentioned much about the side effects, so we're not going into detail. But again, I would like to remind you that what you need to know before getting the vaccine and after that, some side effects of the vaccine for COVID-19 vaccine and for all other vaccines, local or the site of injection reactions are the most common. They become sore, red, burning, itching, or swelling for a few days. And as mentioned, you need to seek medical attention if this goes beyond a few days, enlarging or discharging for some pus, or you find that something there is not as worsening rather than improving. There is fever, fatigue, or tiredness, muscle aches and joint pains. You may suffer headache or some flu symptoms. You feel like as if you're getting the virus. Rash and angioedema, which is swelling. Very rarely allergic reaction, and that happens very quickly when given the vaccine, but it can happen as a delayed reaction. Very rarely severe reactions such as anaphylaxis. And very rarely, again, post-vaccine autoimmune conditions, such as some inflammatory process in the vessels, which we call vasculitis, or some pericarditis, inflammation of the heart muscle, or some neurological symptoms. These are exceedingly rare. So we may be asked, do you need the vaccine? Vaccine depends. Some vaccines are recommended for certain ages, such as infants. Some vaccines are for elderly. Some vaccines are encouraged for special populations, such as pregnancy, asthmatics, immunocompromised, those with low immune systems, and chronic diseases. Vaccines are encouraged during pandemics, such as the COVID-19 vaccine. But you need to understand that probably there might be some contraindication to the vaccine. For example, if a patient is immunocompromised, so they have low immune system, whether they were born with it or they're on medications that suppress their immune system, lower it, live vaccines are contraindicated in these. Also, patients with history of anaphylaxis to that specific vaccine. We encourage that these patients should be seen by an allergist and evaluated, because most of the time it is not really a true anaphylaxis, but best if seen by an expert. So what about the COVID-19 vaccination in chronic urticaria patient? It's important to know that chronic urticaria is not a contraindication to vaccination, whether it's COVID-19 or any other vaccination. And as it was very nicely explained in the previous talk, flare-up of chronic urticaria is really common because of anxiety or stress, or even as a reaction to the vaccination. So this could actually make the patient worried. Next time they get the vaccination, am I going to develop these symptoms again? And more likely the urticaria will flare even more. So the more the anxiety, the more the stress, the most likely your urticaria can flare. And some patients actually do develop new urticaria after the vaccine, which is very rare as well, not very frequent. So good control of urticaria and angioedema is important, and this is something we advise patients that proper control of urticaria is important prior to getting the vaccine. Now, allergy to COVID-19 vaccine, most of these reactions are mild and frequently does not occur with the second shot. Many, as also mentioned in the previous talk, that it does not, most of these reactions actually did not occur with second shots, even with the severe, according to latest studies. They are usually panic, vasovagal, anxiety causes, and the chronic urticaria flare may be misdiagnosed as an allergic reaction, accounting for the increased reported reactions to vaccination. And as I said, anaphylaxis is extremely rare, rates between 2 to 4.5 million per million doses. And this remain in range of other vaccines. In fact, the reported cases of anaphylaxis for the rabies vaccine and MMR vaccine were more than the COVID-19 vaccine. So it really remains in range of other vaccines and not really increased. And this was the recommendations for many countries, that one of the contraindications to the vaccine, if the patient developed severe allergic reaction, anaphylaxis, after a previous dose or to the component of that vaccine, then most likely this patient should not be vaccinated and to be considered referral to the immunologist. And what was interesting is, in some of the studies, many of those patients were actually found to have skin tested, they were skin tested and they were negative and tolerated the second shot of the vaccine. So there are studies now coming up regarding this. A precaution to the vaccine is those with an immediate allergic reaction to any other type of vaccine. And we have vaccinated individuals with a strong history of anaphylaxis to flu vaccine, for example, and they've tolerated the vaccine with no problem at all. What about COVID-19 in vaccine in pregnancy? Well, the Center of Disease Control recommends that all pregnant women be vaccinated. The safety issue was based on data on almost 4,000 women, pregnant women, who participated in the pregnancy registry. So they didn't test them or anything, but because of the risk, they were vaccinated and followed up, and they did not show any safety signals of concerns. And the outcomes were similar to studies on pregnant women before the pandemic. Now, what about your medication when you want to receive the vaccine? So what should I do? Should I stop the vaccine? Will the vaccine be effective if I take these medications? So if you're on antihistamines, it's okay. You don't need to stop before or after. In fact, if you are if you are prone to get urticaria because of stress, you probably might need to increase the dose of your antihistamine to achieve good control if required. As for omalizumab, that's okay. You don't need to stop before receiving the vaccine. However, we advise, or many experts advise, a period between 2 to 7 days between the injections, so that if there is any reaction that happens, any side effect, we would know which one caused it, whether it was the vaccine or whether it was the omalizumab, the drug. What about immunosuppressants? So those medications that lower the immune system. JAK inhibitors such as tofacitinib, for example, or cyclosporine. The recommendation is to stop from the day of vaccination up to 1 week, for methotrexate and azathioprine from the moment of vaccination till after 2 weeks. And if the patient, or if you're on rescue oral corticosteroids, it's okay to continue it if it's less than 20 milligrams per day and you really can't stop it. So the take-home message, reassurance that vaccines are safe and reactions are extremely and exceedingly rare. Use concomitantly antihistamines if you are prone to develop urticaria or if you feel that you're stressed. And always remember, we are here for you, so contact your physician for any concern. Thank you very much.